Ron Vaughn here. Good to see you again. This is Elaine.
Hi.
Elaine, so tell me what you do.
So I am a licensed physical therapist, specializing in manual physical therapy.
So you mainly get physically abused people?
Totally, yes.
Sweet. How does it work as far as someone coming to see you?
So unfortunately, in the state of Texas, in order to be treated by a physical therapist...
So don't move to Texas.
Yes, you have to get a doctor's prescription. It's a state requirement. You have to get a doctor's prescription. You have to go see the doctor before you come and see us, which is very unfortunately because we believe as licensed physical therapists that we are qualified enough to be able to assess and treat the general population without a doctor's script. Yeah.
Okay, so is that gone with the insurance? You take insurance, cash only, or?
We actually do both. There is options. It really depends on the clinic that you work at. Some people do self-pay only. Some people do take insurance. Most physical therapy clinics take insurance, but there are also self-pay options if you want that choice.
Okay. Cool. So if I were to come in here, back pain, right? What's your procedure? How do you go about doing it? What's your routine?
So initial evaluation here at our clinic, what we do is a full 1 hour assessment. We pretty much sit you down, kind of ask some basic questions for the first 10 to 15 minutes or so regarding what kind of symptoms you're having, what ags and eases are, how long these symptoms have been occurring, have you had symptoms in the past, was there a specific mechanism of injury for why you're coming in and seeing me. A lot of the times there isn't one specific mechanism of injury, it's been kind of multiple injuries, or sometimes we always hear, oh, I just woke up with it.
Right.
Very, very common things that we do. So we get just a basic background of what you're coming in for, and then we get into the fun part where we do a true evaluation and an assessment, which is going to include how are you moving, the way that you prefer to move. We test the strength, we test the joints, just to see how you move. And then if you do have that script, we're allowed to treat you on the initial day. We treat the underlying cause, and then we get you on some basic corrective exercises.
Okay.
And really what it comes down to is posture.
Gotcha.
Yeah. Yep. Sit up tall.
So basically, you get a script from the doc or whoever, and then you actually try to find the root of the problem.
Correct. It's finding the cause of the cause. So most people come in with back pain, and then they have like, oh, I might have some radiating pain down my leg. But why? Or I'm complaining, man, my legs are just so tight. I have really, really tight hamstrings all the time. Well, why? Why are those
dancing last night?
Why are those structures tight? Why do those joints get stiff and stuck? Why? Is it the way that they're moving? Is it the way that they're preferring to lie down? Is it the way that they're sitting? It's usually what are they doing in trivial everyday activities that causes tissue breakdown.
Okay. Cool. As far as like frequency, like is there like a pattern, or it depends on the clients, how far you come in, how much you come in?
It usually depends. Most of our patients come 1 to 2 times a week, especially post-surgical patients. They're going to be coming twice a week. But some people, if it's not a super pressing issue that they have to come in for the hands-on treatment, they can come maybe once every other week, once every month. It really depends on each individual patient and each individual case. Okay. So I can't really give you a very specific, like 2 times a week for 4 weeks. It really depends on the patient.
Okay,
yeah.
cool.
It's a continuum. So CPR certified, of course, because of what we do. So I just have my PT, which is the license for being a physical therapist, and then I graduated with my doctor of physical therapy, and I'm also in the process right now of getting my fellowship, and that's through the American Academy of Orthopedic Physical Therapy.
Okay.
Yeah.
So as far as like other physical therapists, is there a specific for manual, or is it all, or you just specify it?
Yes, and so the FAA and PT is specifically through the Manual Therapy Institute, which is an additional 3 to 5 years, depending on how quickly you start your hours after getting your doctor of physical therapy. So it's extensive amount of training, but it's so worth it. I feel like that if you don't get the continuing education, get the continuing training, you're really doing a disservice to your patients.
So it's On top of getting your doctorate?
Yes, on top. Yeah.
Wow.
So 4 years of undergrad, 3 years of grad school, and then an additional 3 to 5 years of weekend courses every 6 to 8 weeks, 17 of those, and then 440 hours to complete your fellowship.
So I do massage therapy, something 500 hours.
Yeah.
So what are your strengths as a therapist, and what inspires you to come in every day?
So strengths, for me personally, what I feel like I'm great at is being able to spot a movement impairment. I'm able to see, just based on how someone stands, where they're going to start breaking down. Mm-hmm. So how do they stand? How do they move? How do they walk? Right. And then we do basic kind of functional screenings, like can they stand on one foot without things collapsing? If they can't do that, we're going to work on that.
Right.
Like why are they having issues with this? So being able to see it, but being able to correct it as well, I feel like is one of my strengths that I have as a physical therapist.
Sweet. And then I guess what inspires you, is it kind of like your improvement, or?
Yeah, I just want to be the best physical therapist for my patients.
Mm-hmm.
My patients are what keep me going, and seeing the progress that they make, and seeing and hearing all these goals, like, oh, I could never squat before, and now I'm squatting 300 pounds without any pain symptoms. Like, I want to hear those stories. I want them to progress. I just want them to be the best person that they can be.
Kind of like Josh, our camera guy, right?
Yes.
Now he can overhead squat.
There you go.
Very true.
Okay, do you have a favorite bodyworker yourself or more bodyworkers that you may have come in contact over the years? Is there someone you see regularly?
Well, because I work as a physical therapist, I have access to my coworkers, right? And if I were to see a very specific bodywork specialist, I would actually recommend going and seeing another licensed physical therapist who is trained in manual physical therapy. We just have a very specific skill set that is not common throughout the just kind of everyday like you say, body workers, but I have that luxury of working in a clinic that I can go see. But just any regular body worker who is trained in seeing movement impairments is who I would recommend.
A certain person you like to see?
No, I get my coworkers to work on me, but I'm lucky in the fact that I do have access to that, whereas the general population does not. So just kind of play around a little bit and kind of see what works for you. I mean, some people like going to massage therapy because that works for them, or they like to go to a Rasti, or they do some Eastern medicine and get acupuncture or cupping. It's kind of what works for you. If it makes you feel better, by all means, go ahead and do it. But that shouldn't be the only thing that you do.
Right. Yeah. All right. Before we do an assessment on me, any last words?
Not really, but just come out and come see a licensed physical therapist if you're really having true mechanical issues that you feel like can be addressed, or if you've done all their alternatives, like you've seen every single person under the sun. Have you seen a licensed physical therapist who is trained in manual physical therapy and trained in seeing and being able to feel and correct movement impairments? That's really what it comes down to. Face down, your butt is mine.
Thanks, Elaine. It was fun. Thanks for helping me correct my body.
No problem.
So,
it's a pleasure.
I want to know who your body worker is because I want to go visit him. So, any last words? Last time?
Yes. If you want direct access and to be able to come see me with a doctor's prescription, go to tpta.org and search for the House bill, sign the petition.
Out. Peace.